Before I move to a discussion about diffuse axonal injury, I wanted to review the appearance of extraaxial collections over the course of time. The density of the extraaxial collection will become less and less dense over the course of time as the blood products are removed and or they resolve. However, one can have recurrent hemorrhages into an extraaxial collection, in which case you may have different aged densities of acute and chronic subdural hematomas, for example. As the collections age, the typical shape of the collection may change. I've spoken on numerous occasions about how epidural hematomas are usually biconvex, lenticular shaped collections. However, over the course of time, and by this I mean weeks to months, that epidural collection may become crescentic in shape. And curiously, subdural hematomas, which acutely are crescentic in shape, may, over the course of time, weeks to months, assume a more lenticular shape. However, one may occasionally see a strange phenomenon of calcification of the extraaxial collection. And this is an example thereof. This patient came in and was being evaluated for sinusitis. And as we scrolled into the intracranial portion of the paranasal sinuses, we start to come upon this area that looks almost like bone and bone marrow. And as you can see, has a component which is lenticular in shape, but also a component that becomes crescentic in shape. And this is bilaterally present. So these are extraaxial collections, initially probably epidural, but could be subdural collections that have calcified over the course of time. You notice that there isn't that much in the way of brain atrophy, so the brain is responding to these collections. What's also interesting is the appearance on the MRI scan. So here is a patient who has a T1 weighted post-gadolinium MRI scan, and as you can see, this collection has some areas that are bright in signal intensity on the T1 weighted scan before contrast, and therefore likely represents the bone marrow fat, if you will, of an ossified subdural collection. Let's see on the T1 weighted sagittal scan, you see that it is bright on a T1 weighted scan, and bright on T1 weighted scan, while it could represent subacute blood products of methemoglobin, in this case, it represents ossification of the extraaxial collections. Here on the T2 weighted scan, you see again these collections. In this case, sort of assuming a more lenticular shape, and on the right, a more crescentic shape. So chronic subdural hematomas, chronic epidural hematomas have unusual shape characteristics and in rare cases may ossify, as you see here.